Today we are here with Dr. Adam Cirlincione from Midtown Podiatry. We're going to be talking a little bit about hammertoes. Dr. Cirlincione, what exactly is hammertoes and how would someone develop them?
Well, a hammertoe is quite simply just a bend of the toe at a specific joint. If you take a look at the picture here, you'll see that this toe does not lie flat to the ground, but has started to curl up and bend at a specific joint. So a hammertoe is really just a contracture or bend of a toe at a specific joint. Most typically, hammertoes are developed or passed down from one generation to another, so they're something that are familial. Shoes can aggravate them. Tight, pointy shoes can be something that can be a cause for discomfort, but may not necessarily be the exact cause for the development of the hammertoe.
And what are some treatments for hammertoes?
Any foot problem can be treated conservatively or surgically. Typically, a conservative treatment for a hammertoe is padding, shaving of a corn or a callus that's developed from the contracture or the bend of the toe, wide toe shoebox, or open toe shoes. In the wintertime, it's a little bit difficult to walk around with an open toe shoe, so you start to see aggravation of hammertoes a little more frequently in the months that women, even men, are wearing closed-toed shoes.
And what would be the recovery time for a hammertoe surgery?
So surgical treatment for a hammertoe typically is anywhere from 2 to 4 weeks of recovery, where a patient's in a surgical shoe or a boot post-operatively. It does vary from patient to patient. If they're having other surgical procedures done, the recovery can be a little bit longer, but typically it's anywhere from 2 to 4 weeks where the patient's in a surgical shoe or a boot and has been advised to take it easy, rest, ice that foot, and elevate as much as possible following surgery.
Are there any complications associated with the surgery?
No surgeries are without complications, so hammertoe surgery fits that bill also. Some possible complications of hammertoe surgery are shortening of a toe, chronic swelling to a toe, post-operative infection, a toe that does not sit perfectly flat to the ground, and some painful scarring or some numbness.
Great, thanks so much.
Have a great day.